Sorry for the delay, everybody. Wouldn't be another Zoom meeting without having some kind of technical problem. Welcome, everybody. My name's Anthony Ansaldi. This is our second public health forum that's sponsored by the Board of Health. And just want to start by few ground rules. If you have any questions, we do have some questions that were submitted in advance. Thank you. If you have other questions on the Zoom, you can either raise your hand or you can go into the chat function and type in your question. And then I'll see that there is a question and I'll repeat the question for the panelists. So with that, I'd like to start by introducing our panelists for this evening. The first person, our public health nurse, Miss Mary Beth Ting, our Captain Kevin DiNapoli from the police department, our fire chief, Chief Stephen Kavanaugh, with them also is on Jeff Baxter, and our Board of Health representative, also public, registered nurse herself, Regina Baker. So I'm going to ask each panelist to briefly just give an overview what's going on, and then we'll get into the questions. So if I could start with Mary Beth.
Thank you very much, Anthony. Good evening, residents of Wenham and other guests who may be joining us from outside of Wenham. Thank you so much for taking the time to tune in and hear the updates about the coronavirus affecting our community. I'll start by reviewing the current case count in Wenham, which at this point in time, we have had 7 individuals from Wenham infected with the coronavirus. Thankfully, 6 of the 7 have been cleared from isolation and have recovered from their infection. We have had a number of individuals who are close contacts or household contacts of those individuals who are in quarantine. Many of whom have completed their quarantine. I would say that one of the changes, the state up to, I believe it was yesterday, was the first day that the state started reporting case count data by community. So if you look on the mass.gov website, you can see current case counts, not only by county, which they had been doing from the beginning of the crisis, but now, as of yesterday, 4 p.m., started reporting community by community. So there are 2 numbers that they report. One is the total number of confirmed cases, and then the number after that is a number. Just trying to look and see if I had it available. The number that it shows is the rate of infection, and that is the number of cases per 100,000 people. So it's a ratio. And that's, as you look at the counts, it'll give you a sense of what each community's burden is of the virus. So ours is like 134, I believe. So, you know, not quite different from other communities our size and locality. So far we're doing okay, but I will reiterate that the case number really only tells us the number of individuals who have tested positive for coronavirus. And as I'm sure you've heard on the news and read in the papers or whatever news outlet you have, getting testing has been difficult. It's getting better. We're getting more access to testing, but we still have difficulty. And so there can be individuals who are presumed positive. They're being told to isolate by a healthcare provider, but they don't show up in the case count. So even though it's showing 7 and we can feel good about that, the number may actually be quite different from what we're getting in terms of testing numbers. So my urgent plea to all residents, thank you so much for everything that you're doing and the guidelines that you're following, and they continue to be stay at home unless you need to go out for essentials. That's food, medication, an urgent medical appointment. When you leave your home for those things, please do wear a face covering. We have guidance on the COVID-19 page of the Town of Wenham website, which will guide you. We have linked up with the CDC, which has great information about how to make a face covering at home from things that you would have on hand. Remember, good hand washing is extremely important. That's soap and water, rubbing for 20 seconds before rinsing the soap off your hands, or using alcohol-based hand sanitizer. Wash them much more than you ordinarily do. Always wash your hands under certain circumstances before you eat, after you use the restroom, those kind of, after you've covered a cough or sneeze and blown your nose. Disinfect your commonly touched surfaces, and those kind of things. Those prevention measures are things that all of us need to take into account. And I'll talk a little bit more at some point during this forum about physical distancing, which is the term we're using now rather than the social distancing. So I want to thank you all for tuning in, and we're eager to answer your questions and provide you the information that we have at this point. Thank you so much.
Thank you, Mary Beth. I'll go to Chief Kavanaugh this time. Chief, Fire Chief Steve Kavanaugh.
Welcome, everyone. As most people are probably aware, the doors of the station are locked. We are doing some inspections, but not many. There is a phone outside of the station that you can call, which is a direct line to the rec center. And we are responding to every call. And just a little something, what to expect when we show up to a medical. When you call regional dispatch, the dispatcher will ask you several questions. If you answer yes to any of the specific questions, they will then tell us to use caution and ask you if you can actually ambulate to the door and meet us outside. When you do go outside, we will have one person that will meet you at the door. And of course, they'll be wearing a gown, a mask, eye protection, and gloves. And at that point, we'll take the call from there, what direction we have to go in.
Thanks, Chief. Regina Baker from the Board of Health, who again is also a registered nurse. We get that extra bonus of that. Welcome.
Thank you. Yeah, I'm a member of the Board of Health. I'm grateful to be a part of that. This is my third year. And I actually joined because I have some experience in emergency preparedness. So that was my my background. But just to bounce off of what Mary Beth said, all the information is basically working on the Board of Health, and all the protocols and different things and the guidances that we've done is for the protection of the community. And it's all about you, the community. So I'm glad to be part of that. I bring a little bit of experience from the emergency room, so I'm able to see frontline the cases that do come in. And I do know for sure that there's a lot of patients that will present with the symptoms. They're not necessarily tested, so they do go back to the community following the guidelines to quarantine and all of that. So the numbers, again, that we see on the database isn't always reflective of the actual count. But we're all working together to flatten that curve so the numbers will go down regardless. But I'm happy to be here and to be part of this forum and to do whatever I can to help.
Thank you, Regina. And Captain DiNapoli.
Good evening, everybody. I'm equally as happy to be part of this forum earlier today. It was very successful. I thought super productive across the board to share the information. I think the best thing that we did under Anthony's guidance was very early on having our regular meetings, real out of the gates when all this was starting to transpire. And what that allowed us is our partners in public safety with the fire department and our partners with public health were able to have the regular meetings of information sharing, and that hasn't stopped. And it's been phenomenal because it's just so evolving for law enforcement practices as well. It's day by day. We're getting tutelage from Mass Chiefs Association and other law enforcement factors that are presenting different ideas, different procedures, different ways of handling things. As most recently, you're going to see our officers out and about around town when they are outside of their cruisers with their masks on. We put that special order out recently. We also are doing regular check-ins as we've been doing all along. And now literally every shift, our officers are checking in relative to how they're feeling, any symptoms, anything we need to get a hold of and stay ahead of the curve. The main thing the folks in town, we want them to know is we're going to be constantly available and we're going to be constantly visible. You're going to see us out and about, and our ability to respond to all calls that require our immediate need for emergency services will be there. We've streamlined some of the different types of calls when possible to be able to do them either online or over the phone. But if the need arises and we have to, based on what is dictated by the calls for service, we'll certainly meet in person as well and do what we have to do. But we're proud to be a part of the team, and we're going to keep moving forward day by day.
Thanks, Captain. And what the captain was referencing is we do have 3 times a week, Monday, Wednesday, Friday mornings at 8:30. We have a Board of Health, Public Health, Public Safety meeting that goes sometimes a half hour. Sometimes we need to stretch it to an hour. And that's at the very least. And then there's times in the weekends where we may have to touch base with each other on a matter that's come up. So not on our panel that I just want to also introduce here, and Jim will give a little overview. So one of the things that we as a community were concerned about is our most vulnerable population, those being over the age of 60 years old. So we really tapped into Jim and his resources, and he's been doing some great work as far as reaching out to that segment of our population. So Jim, would you mind? I know you're not a panelist, but people did want to hear from you. So unmute.
Yeah, well, thank you, Anthony. Yeah, so we're pretty much out the other end of the calls that we plan to make. Although, we ended up after kind of looking at about 1,050 names, we ended up calling about half that number, or getting through to about half that number. And I guess the good part of it was we got to kind of play around by contacting people in their neighborhoods a little bit. People that lived in those neighborhoods were making those early calls, and I thought that was just kind of a good model for us to start with. And we ended up with about 65 residents that asked for check-in calls and so forth. So I think that's representative of kind of the fact that it was a worthwhile effort, I guess, more than anything. So, and the other thing is, we incorporated a lot of different people into it. So we had, veteran services and finance and land use permitting, different people from all these different departments helping to make the calls, and I think that was really good too. Just a combination of volunteers and other people in the town hall helping. So I feel like that was great, in that isolation is something that was something deemed it by the World Health Organization as a crisis before this hit. So it's just exacerbated by what's going on now. So anyways, but I feel like we're starting to, I'm talking a lot more with other COAs in our what they call catchment area, which is basically Cape Ann and 9 communities under senior care. And so we've never really talked a lot. So we're getting, I think that's a good thing for us to be talking. So we'll come out the other end better for it. That's all I really have.
Thanks, Jim. And by talking, I assume you're meaning more Zoom meetings, correct?
Yes, yeah. But they're quick. Like, we knocked one down to half an hour, with 9 people, and that's right on as far as I'm concerned.
Yeah, that's great. Great. Thanks for everything, Jim.
Yeah.
So again, if you have any questions, you can also through the chat function or raise your hand. And I also have 2 monitors going on. So if you wave for those that are on camera, I'll be able to catch you. But I'm going to start with some new questions as a result of the forum this afternoon. So first one, the phone announcement to residents mentioned closed parks and trails and something about walking on Route 97 Topsfield Road. But it also said residents may still walk in their neighborhoods. If we live on Topsfield Road, may we walk or run while maintaining appropriate distance from others we may encounter? So it's a Kevin, Captain DiNapoli, I think that's a you and Miss Mary Beth. If you could, Mary Beth, you want to take it first?
Sure. So it's a wonderful question. We do definitely want to encourage people to get out, get some, we're all deprived of vitamin D activation in Massachusetts and New England. So we do all need to get our sunshine after coming out of the winter. So you do want to get outside and get some exercise. It's good for your physical as well as your emotional health. If you're on a major road like Topsfield Road or some of our other roads, the distancing can become more of a challenge. So I live off of Topsfield Road, so I'm familiar with this. So for when I'm going to be walking in a thoroughfare like that, I will put on my mask. Now, I wouldn't necessarily need it in my neighborhood because the streets are wider, but if you're going to be on a road where, there's sidewalk only on one side of Topsfield Road. So if you're going to be passing someone else, you might be at closer distance. So I would encourage you to consider a face covering if you're going to be on someplace where you're going to be sharing sidewalk space with someone else. And then just exercise courtesy. So when I was out the other day with my daughter and my dog, if someone was approaching us, we would wait in someone's driveway to give them enough space to get past. Just work it out with your fellow exercisers, fellow walkers, fellow joggers, whatever it is, to just make some space for each other.
Can we expand too on the Board of Health, the selectmen took action to close the trails, the access to the trails. And why was that so important? What were we seeing there?
So I can start with that, and then I'd also invite Captain DiNapoli as well as Regina. But there's a couple of things unique to Wenham's part of the rail trail, which is our primary access is on Route 97. And the Board of Health took the action that they did just in the days following a fatal bicycle accident in Ipswich. And there was real concern that with the enormous number of cars that were on 97 and families coming out with small children and bicycles, there was real concern that we didn't want to see something terrible happen there. Additionally, part of the section of the Wenham Rail Trail involves the Swamp Walk, which is less than 6 feet in width. So if you're going to be passing with someone, it's literally impossible to keep good social distancing, good physical distancing from one another. Anthony, before I kick it off to the captain or Regina, I would just notice that I did see Mr. Rick Woodland was raising his hand. So if you can make a note to come back there.
I just recognized that in the chat. We do see you, and once we finish up this, we will go back to Mr. Woodland.
Okay.
Captain?
Yeah, so what had happened, we were getting quite a few calls from residents on some of the side streets, and then from residents as they drove by the rail trail and other areas regarding the vehicle traffic. And it was hard when folks were parking on some of these side streets in the warmer, nicer days. And unfortunately, we didn't touch on this earlier, but there was some debris being thrown on the ground too relative to masks and gloves and things of that nature. And it was upsetting some of the residents on the side streets. So having the ability to take action, enforcement action, if we have to, which we haven't had to as far as money fines at this point, thank God we were just able to give parking warnings and to move people along. But now that we have the authority that was voted on by the Board of Health and by the selectmen to allow us to take that action, since everything has been formally posted, it's been much better on 97 and on Conrad Circle in that area. Same thing down by Pleasant Pond and the beach and Pleasant Street and whatnot, that it's given the officers the ability to take action if and when they have to. But as mentioned earlier, 99% of the time, folks have been respectful. They've been deferential to the police officer, making notice of what the issue was, and they've moved along. The best thing is we've been seeing a lot. Jackie has forwarded to me a bunch of phone calls that have been coming through from people before they take action, asking if they're able to do X, Y, or Z. And I've been able to call them back and say, hey, thanks for calling. Unfortunately, that's restricted at this time. And people are great about it, but it's those people that are taking the time to do their due diligence to find out ahead of time if something is okay, that it makes it easier on everybody involved. And that's what's helped out quite a bit.
Thanks, Captain. We're going to go to Rick Woodland.
Thank you, Mr. Insaldi.
Anthony.
I wanted to follow up on the procedures for those. I drive down 97 a lot. That's my way to the market. And what I noticed over the weekend on Sunday when I went to the market, that there are people walking on the sidewalk, which is great. And they seem to be with their face mask on, their protection on. But then I see the runners and the bicyclists speeding by them without any face protection. And what's the position? I mean, I know when you're exercising, you need more air, but also I'm afraid that you're breathing heavier. So if you are ill, you're pushing that further. And is there a position the town can take on that, or is it just part of the running and biking experience?
So that was a part of our discussion with our public safety meeting. And Mary Beth, I think you had a good article. Maybe you want to share on some of that?
Well, I think we're still waiting for a little bit more science on the slipstream effect. When people are exercising, and directly to your point, breathing more heavily and exhaling, because there is some questioning and some literature that you'll read about. Is there the potential for airborne spread in addition to droplet spread? Whether when you're breathing heavily or speaking, whether you might be shedding some virus. So, we're waiting for better science on that. But to your point, it's very difficult. I mean, we have no idea where the runners and cyclists are coming from. Are they from Wenham? Are they from Topsfield? Are they from Beverly? Are they from Danvers? I think, we're all trying to get these common prevention measures out to everyone. I would say, for someone who is exercising, a really prudent thing to do would be to use, one of the looser masks, like, the t-shirt mask, that's the do your own no-sew t-shirt mask, or face covering. I got to remember to use that terminology. The CDC has all of that stuff right on their website. So whether it's a bandana, so it's not feeling particularly occlusive, but allows you to exercise and still have the face covering. I do agree with you that I would like to see that happening, and we're trying to encourage that message as much as we can.
Thank you. I would appreciate that, because I felt bad for the people who were walking on the side of the road, and they were observing that mask or face protection piece, but yet the jogger, and I know they don't understand exactly all the transmission methods, but as a town, I know we're trying to be more safe than sorry. Yeah. Thank you. Thank you.
Great question. Thanks, Rick.
I think Regina had her hand up, Anthony.
Oh, sorry.
Oh, I was just going to go along with the reason of the blocking off of places such as the rail trail or Pleasant Pond, or even the canal, for that matter. Those are all places that there is no way, with the popularity, with the weather getting nice, with more and more people having more time and being out more, our thinking at the time that we made the decision was that as people all gather and more groups of small people gather, they get closer together, and there's no place to physically get 6 feet apart. So it wasn't to take those areas away. It was just to keep people safe while we go through this. That was all.
Thank you. Thank you. Great point, Regina. And I'm going to go to Michelle Bailey's question, and I want to add to the end of her question. The question is, do the number of reported cases represent all the cases that have ever been diagnosed, or only the known active cases being monitored? So with that, to our two nurses, so I hear, in addition to that, I hear that there's folks that will call or they do the video meeting with their doctor and they'll go over the symptoms and they'll say, it sounds like you probably have it. If you're not having respiratory issues, then just monitor your symptoms and, Tylenol for fever and so forth. And they don't have them come in for testing. So how does that add to Michelle's question?
So to answer Michelle's question, thank you for it. The number that the case count that we have on the website and the case count that you'll see on mass.gov is only confirmed cases by testing. So I've been trying to continue to say the actual burden of disease in our community, as well as many communities, is probably to some extent higher. I don't know the order of magnitude higher, but higher than the case count reflects itself because of the difficulty in accessing testing. So to the point that Anthony was just making, sometimes individuals who appear to be infected with COVID-19, for instance, they may have had a close contact and then they develop symptoms. Perhaps they cannot access testing. Those are not going into the case count numbers. We are presuming that they are infected, but they do not get reflected in the actual case count. So I would say from a public health standpoint for Wenham residents, if you are someone who is told by your healthcare provider, yes, it sounds like you have COVID-19, please go home and isolate yourself. I would really appreciate it if you would call the Board of Health, and our number is 468-5520 extension 4. The reason I'm asking you to call the Board of Health, I would personally like to check in with you to be sure, do you have groceries on hand where now you're isolated and you're not going to be leaving your home? If you're living with other people in your household, do you have the supplies that you need to keep them safe? Do you have a mask for yourself or a mask for your loved one who's going to be handling your laundry or bringing you food? Do you have access to the medications that you need? Do you have access to a thermometer to be able to check your temperature? Those are some of the things that I'd like to check in with you. Additionally, if we're assuming that you're infected, it would be good to talk about who else might we need to be talking to about restricting their movement, being in quarantine. I know that many of us are using the term quarantine. I'll just take a minute to define. Quarantine is the term for those who are restricted to their home. They are not leaving their home and no one is coming into their home because they have had close contact with someone who is infected. Isolation is the term for those who are infected, who are not leaving their home, and even within their home are removing themselves, sort of constricting themselves to a separate bedroom and hopefully separate bathroom from other members of the household to prevent the spread within the household. So I hope that answers your question, Michelle.
Regina, you want to add to that?
Yeah, I think what the point that the takeaway point from what Mary Beth is describing regarding contacting her, the public health office, the Board of Health, helps to flatten the curve because then she can guide, any of us, we could guide you in the steps you need to take so it's not so loose. Make sure you get what you need so you're not contaminating others, and to also do some tracking as far as who you've seen before. I know that the policy for the hospital system that I work at is if you come in and you have symptoms and you're sick enough to get admitted, those are the only people that are tested. If you're walkie, you're talking, you're okay to recover at home, then they do not get tested, but they're sent home under the, to kind of with the guidelines that we give them there in the emergency room. But it's great to have another set of eyes on someone and some more support from the community. I think that's helpful, and will keep things a little bit tighter to help us all to prevent the spread.
Thank you, Regina. There's a question, staying with Regina. There's a question is the Wenham Board of Health considering requiring face covering similar to Hamilton's recent action?
What's the question?
Is the Wenham Board of Health considering requiring face covering similar to Hamilton's recent action?
Thank you. Yes. In fact, we had a meeting the other day, and to follow suit of Hamilton and also our surrounding communities, we are following basically the same guidelines that they have as far as wearing face masks, cloth masks. They don't have to be surgical grade. They don't have to be, the masks that you wear in the hospital, but a cloth mask you can make yourself when you're entering a building that is a public building, like a restaurant. I know the fire station is closed, but if you had to go in there, or the police station, even town hall, which that is closed too, but to have a face mask on, employees at those places also to wear a face mask to prevent the spread of the virus. There's guidelines that are set out that should be on the website. I think our enforcement starts at 12:01 a.m. Friday morning, and the businesses have been notified. It's something that is important. We're following the state guidelines, something that needs to be done, and the prediction of the surge, just to keep everything prevented.
And that goes as well as for municipal buildings, correct?
Correct. Yes.
Thank you.
Anthony.
Mary Beth, the question going back, Bethany Wright asked, can Mary Beth repeat what she said about the residents diagnosed? Do the state numbers include those recovered as well?
No, the only numbers in the case counts that the state is providing is actual confirmed cases of infection. So that's representing the number of individuals who have had a test for COVID-19, which was positive. The other number that the state is reporting is they are reporting deaths. I believe, I can pull it up, but I believe it's death by gender,
Yes.
decade of age, and community. And additionally, it's whether or not they were hospitalized, and one other thing. It's right on the mass.gov website, but those are the only things that they're reporting right now. They're not giving data on number of individuals recovered. I believe the state is also providing number of individuals subject to quarantine. I'm just going to try to look. I don't want to hold you up. We can move along and I can
Okay.
chime back in with what I find.
All right, well, you're looking at that. I'll throw this question to Regina. Regina, when you go out to the store for groceries or medications, what should you do when you get home with these items to prevent the spread?
I think we talked a little bit about that on our last panel, and Mary Beth had presented so great. There's ideas of that because there's something that's gone viral about wiping everything down. Once you get in the house, washing the surfaces on, washing your hands, and to reiterate what she said, it's a good idea. It gives us a sense of control, and if you think about things inside of a grocery store or the pharmacy, if we're wiping down surfaces that are commonly touched, if you bought a can of soup and somebody else looked at that can of soup and put it back, I mean, it's probably not a bad idea. Just to wipe it with a regular household cleaner. We should have some alcohol in it. Things that are gonna kill the germs. And it does, again, it gives you a sense of control that I've never cleaned more doorknobs in my life, and so it's similar to that, and I feel good about it. So it's not a science. It's not something that you have to do, but if we're cleaning every other surface that's touched, why not? Sure.
Mary Beth, want to add to that?
I just would agree with Regina. I was saying earlier that it's a Michigan physician whose video has gone viral on Facebook about the steps to go through to what to do with your groceries when you're bringing them home. And it's, I will share that I am doing that with my kids. It's kind of fun to have my kids a little bit more involved with unpacking groceries. And I don't know that there's strong scientific basis for that this is going to protect, but I was saying earlier today that this is a time when we're all feeling very frightened. It's a new virus. There's a lot that we don't know. And so exercising hygiene around the things that you bring into your home for yourself and your loved ones, that's not a harmful action. If that helps you to feel better about taking care of your family, then I think that's a wonderful thing to do. I wouldn't want anyone to feel that they were being irresponsible or not doing what they needed to do if they weren't undertaking those tasks. But if it helps you feel like I'm doing everything I possibly can in an uncontrollable situation, when we've had to take away certain things like trails and playgrounds and parks and schools and all of these things that we rely on for our mental and social health, even physical distancing from those that we love. If this is something you can do that helps you to feel better, please go ahead and do it. Whether the science is there or not, you're not going to harm anything. So, washing your fruits and vegetables is always a good thing, no matter when. Washing your hands after you handle groceries is always a good thing, whether it's COVID-19 or not. So we all might be getting an added benefit of better hygiene that we take going forward into our life, which is a good thing.
Thank you. Thank you. I'm going to shift back to public safety, to the chief and the captain to talk about what other actions are we taking to check on our staff, on our call firefighters, and to make sure that they're healthy and they're not bringing something into the stations. Chief Kavanaugh, you want to start with this one first?
Sure. Every call that we have a digital thermometer. We take everyone's temperature when they enter the building. We also, every morning, we have them answer a 10-question survey about their health. We're constantly wiping down the station, minimum twice a day, and the vehicles. We are also fogging the station and the vehicles and the ambulance. The ambulance, of course, a little more detail. And that's about it. We're constantly on top of it, the sanitation.
That's great. Thanks, Chief. And Captain, some new things that are going on in the police too?
Yes, similar. We're doing regular check-ins. Some of our reserve officers may not be working on a regular basis. They may go a week or so. So we're doing regular check-ins with them. We have a check sheet similar to the fire chief mentioned, where we're going over a standard list of questions to see if there's any reason for concern or subjects that are symptomatic that we would obviously fill their shifts before they would even bring anything into the station. For the people that do show up prior to every single shift, we have a check-in table that deals with taking the temperature, filling out some other questions. We also have the inside of each cruiser at the end of every shift and at the beginning of the next shift, because it's a little redundant, but we'd rather have overkill than not enough, and we're cleaning it down. It's a small confined area, and that's our officer's office for that 8-hour period. So we're really strict with staying on top of that. And then we also do have the station, same thing. We have sanitized through the fogger on a weekly basis as well. And our custodial staff and reserve officer Mike Perry has been phenomenal with keeping us on top of things relative to making sure the personal protective equipment is fully stocked in each cruiser, along with each individual officer having the masks and the gloves and the other equipment that they need. And on a regular basis, we've been on top of that as well.
Great. And going back to the chief, they'll call firefighter respond. Tell us about that action you took as far as having them the ability to clean their vehicle and so forth after a call or before coming in.
Yep. Well, responding to a call, not everyone comes to the station. They don't bypass the call. They go direct. And each firefighter has a bag which contains a mask, gloves, eye protection, and a canister for their SCBA mask. So if you happen to see someone walking around with that mask, don't be afraid of them. That's just what they're using to breathe out of.
Thanks, Chief. And Cameron Taylor has a question, and is everyone susceptible to the virus or are some age groups immune? And can animals carry it? Mary Beth, looks like you were gonna, okay. And then
Yeah,
we'll go to
I was
Regina.
not particularly ready for that question, but we did talk about animals during the last forum. So I did look at the CDC website just to refresh my information. So are all age groups susceptible? The answer is yes. You've probably heard that there are some groups that are more susceptible to more severe illness from this virus. And those groups would be elderly, people with underlying health conditions, people who are immunocompromised. The underlying health conditions or immunocompromised could affect any age group, but tend to be a little bit more common in our seniors as well. And immune response tends to wane as we age. And so that also affects the elderly more than a younger population. In terms of animals, you probably heard the news item about the big cat, the tiger at the Bronx Zoo who was infected. That was a case of human transmission to an animal. So the human caretakers seem to have infected the tiger at the Bronx Zoo. The CDC website has daily life coping animals, if you have animals. So there's currently not evidence to show that companion animals can spread the virus. Guidance about if you own pets is not to have your pets interacting with anyone outside your home. So they're advising, no doggy play dates, no going to the dog park. Keep your dog on a leash so it's not interacting with other dogs, because again, if you treat your animal just like it's a member of your household, we are not mixing with members of other people's households right now. So your animal is exactly the same. It's treated like a family member. You keep your family member within the family until we get to the other side of this. They also do advise if you're sick with COVID-19 to have someone else in the household, if possible, take care of your animal. And just a reminder that, guidance all the time with companion animals is if you've handled your animal, wash your hands and good hygiene around your pets.
Regina, anything to add or?
Just to emphasize about the fact that it does affect all age groups. There are some that are more at risk, like Mary was saying, that as you get older, they tend to be more frail and more difficult to fight back. But I just saw, I think the other day, 90 plus something come out of the hospital recovering from it. So everybody should be aware, everybody should be careful. And it's just one of these things we're still learning about, and it can hit one person one way and another person another way. So everybody should be following the guidelines. So yeah, it affects everybody.
And Michelle, I see Michelle Bailey, your hand is raised, and I know I didn't get to all your questions. You want to jump on and ask?
Yeah, I just wanted to clarify. So in Hamilton, it's required that you wear a face mask if you're going into a public building. That statement is not on the Wenham website. So that is my question. Is it required that if you're going into any building that you have a face mask in Wenham?
Regina?
Well, I believe that is what the motion that we made was, for people to be required to wear a face mask going into a public building, such as a store or whatever, and also for the workers at the building to be wearing the mask as well.
Michelle, what was the last time?
I just looked at the website. How will the public know that?
Because it should have just been uploaded. Jackie sending me a message on my phone that says that they just uploaded it tonight.
But most people aren't going to go to the website tomorrow morning to be like, hey, when I go out, do I have to wear a face mask? So how will people know to change their behavior?
I'm going to go Mary Beth first.
So Michelle, I appreciate the concern. I think Jackie's going to speak to the posting of it. This was just a Board of Health meeting last night, but in effect, this is recognizing with an order behavior that should have already been changed. We have been asking people, if you leave your home, cover your face. That's come out from the CDC at least a week now. So it's not really a change in behavior as much as, well, I don't know what the word I want to use is. It's, coming from the Board of Health to say we're requiring this. The CDC was recommending it, we're requiring it. So I will restate again that part of the everyday prevention measures that all citizens should be taking, regardless of where they live or how old they are, is stay home unless you need to go out. And if you go out, cover your face.
Thank you. I'd like to welcome Dr. Ting, who's coming to us live from the Caribbean.
Yeah. So I'm on mute. Okay, good. So part of that, Michelle, is that we're contacting all those businesses and places of, if you look at it, it's described as an essential business that's open to the public, and then restaurants, and then we've also added municipal buildings that per order, they will need to post that they are requiring a facial covering over your mouth and nose in order to enter the building. So that is one of the things that these places will have, so that you will see before you enter it, posted on a door that it is required in order to enter. So whether you, all the citizens of Wenham need to know per se, which we can obviously do one of those reverse 911 robocalls, the business in which you are going to enter will post it. Does that make sense?
Yes. I would just say that I was in a public building like a week ago, and that was not the case. So I just wanted to be sure that.
Yeah, but yeah, because we just voted last night, and so it will be effect tomorrow.
Thanks.
Yep.
Let's see another question. You just check. Oops. All right. Question: is it possible for someone that has the virus to get it again?
So the short answer to that is we don't know yet. We're still learning about what happens with the immune response to this virus. There's some small anecdotal reports coming out of China that we're paying attention to, but all the epidemiologists I talk about believe that there's an immunity initially after immediate recovery, but they're not sure how long that immunity is going to last. So I would say that the most prudent thing for people who have been cleared for isolation is to still stay at home until we get to the other side of the crisis, until we have more science to advise us.
All right. And why is contact tracing important to our first responders? And are our first responders knowledgeable of positive households or potential positive households? So if you can answer the first part, and then we'll jump over to the chief and the captain for the second part.
Yeah. So contact tracing is the term that we're using for when you have someone who's infected going back in time 48 hours, because people can be shedding virus, they can be infectious 2 days prior to the onset of their symptoms. So we're going back in time to track who they might have had close contact with, who might also have been infected. So that's what contact tracing is. And you will have heard in our state that there's a new contact tracing collaborative, which is through Partners in Health, and they're going to really be helping with the contact tracing throughout the state, because that's going to become really important as we, get through the surge, so that we're really keeping a cap on those who have been exposed, so that we stop continued spread. One thing that's different right now is usually our first responders are not notified of private health information, like who has what condition. But in this COVID-19 crisis, the local Board of Health partners with first responders to let them know if we have a confirmed positive case. I let them know the address of that individual, just so that they know if they're responding to a call at that address, they need to show up in full personal protective equipment. As you know, you've heard personal protective equipment is not, growing on trees. They have enough to take care of their needs, but they cannot put it on for each and every call that they go to. So considering that our Wenham forces are small, we have a small fire department, small police department. They are small but mighty and wonderful, and we need to keep them safe. If we have an exposure and we have to start quarantining members of our public safety, then we have a problem as a town. So we do need to, that's one of the reasons why I would like to hear from people if they're presumed that they're positive, is so that I can do my very best to keep our public safety officials safe and well and on the job and not quarantined at home.
Thank you, Captain.
Yeah, if I could just add to that, it's important that it's noted that, as Mary Beth mentioned, yes, we only get the address, and we're under, as is the fire department, or the police department is under strict guidelines that is for public safety information only, that is not shared with anyone outside the realms of the police and fire department, and is we don't get a name, we don't get a date of birth, we get an address only, and it is not, I just want to triple confirm, it is not shared with anyone outside the walls of the police or the fire department.
Chief, anything to add to that?
Yeah, like Mary Beth said, it's extremely important to get that upper hand, because we ourselves, we can't let it run rampant through this department because we are so small. And again, we don't want to bring it home to our families. It's great to have that upper hand.
Yeah, thanks. And it's a great point, Chief, that we're small departments all across the town. That's why we follow the action that the governor had in closing the building to the public. Our staff is working, some completely remotely, others are back and forth, which takes a lot for them. There's a tremendous amount of work, and we can't afford to have two people go down, the treasurer and the assistant treasurer, because they're the only two folks that process the payroll. DPW, what we've done is we've also mandated that they no longer go in 2 to a truck or 3 to a truck. They take individual trucks, and we have them on shifts too. So half the crew will be working this week. The other half is doing training at home with various types of training that we've got available through our vendors at no cost. So we're taking advantage of that. I just want to do a shout out to Nikki Roebuck, who has just been instrumental in setting these up and providing the public service announcements that you probably may have seen on Facebook. She continuously works on the website and continuously goes above and beyond what we ask of her. So I just want to thank her too. I want to mention also, and Mass 211 is a great source of information. If you have any questions that any hours that it's manned 24/7, reach out by dialing 211 from a landline or a cell phone. And you can also go to the website. I'm going to go through our panelists, and just for some closing thoughts, I don't see any other questions, so I'll start with Regina.
Just again, thank you everybody for the interest in helping us learn more about what we can do about this virus, how we can keep ourselves healthy. All of the feedback was great. And just, this is a new virus. It's something that we haven't had before. So we don't have a historical reference, a database to work on. So what we're doing, it can change every day. We're doing our best. I think everybody in the community is doing great, and everybody's been great support to each other. So I'm glad that we could have this panel, and looking forward to getting more information out whenever we can. Please contact Board of Health anytime for any questions.
Chief Kavanaugh?
Yes, I think the town of Wenham has done such a great job, all the residents. and just trying to deal with this whole crisis. We are in it together, and we have to stick together. And the best way to help the first responders is to stay home. And if you do have to go out, do the social distancing, 6 feet apart, and please wear a mask. Thank you, everyone.
Dr. Ting, our Board of Health Chairman, would you like to do some closing thoughts?
Again, I mean, this is a great opportunity for us to show that we are trying to keep up with all the new changes that are going on, both with the Massachusetts Department of Public Health and the Centers for Disease Control. Every day there's something new we're learning, and we're trying to keep up. And we are trying. The Board of Health, I think, has met more now than we've met in the last 3 years. But we will continue to meet almost weekly as things are changing, and to protect our community and the health of our community. So we will do work with the rest of our public safety, town administrators, and the rest of the folks, so that we can make sure to weather through this as quickly as possible.
Dr. Ting, there's a question, maybe you as a physician may be able to answer it. Are there any services for people who may be struggling with mental illness or mental stress throughout this?
Yes, there is on the Mary Beth probably knows too, there's both on the Mass DPH website, CDC, there are links to mental health resources, SAMHSA, which is, I forget the name, what it stands for. Mary Beth, you're muted, so we can't hear you, but what's
Substance
SAMHSA?
Abuse Mental Health Administration.
Yeah. So they also have links, because it's causing a lot of anxiety, especially with people being quarantined at home. So that is very much on the rise. I know that many behavioral health organizations are doing a lot of telemedicine or phone calls to help people get through this time. There are, if we don't have resources on our website, maybe we can get some up, Mary Beth.
Yeah, it's a great point. Yeah, thank you. And we'll jump for Captain DiNapoli, and then Mary Beth, we'll round you out. Captain DiNapoli, final thoughts?
Yeah, just quickly, I just want to say how incredibly proud I am of the men and women of our police department, that since this has begun, they've been there day in and day out, just being part of the ever-changing duties and responsibilities that are happening because of this. We're all learning just like you guys, and just understand that we're out there, our men and women are out there, and you can have confidence in your police department that should the need arise, we're right around the corner. And we just want to thank the public for making our job easier by being so cooperative with the different enforcement regulations that we have to adhere to. And it makes our job and the lives of our men and women a lot easier. So thank you.
Thanks, Captain. And Mary Beth.
Well, I just want to say it's so gratifying with these two forums today to see a good number of Wenham residents participating. You're the reason that we're doing all of this. We're concerned for the health and well-being of all of our residents, and wanting to do the very best we can to provide you the help and the resources and the information you need to stay healthy during this time. As we think about the question about mental health, I would mention that as we started through this process, language and information keeps changing as we go through our experience with COVID-19. And where we started out with social distancing, we're now moving more toward talking about physical distancing, recognizing that connecting socially is so key for our well-being. Jim had mentioned earlier about isolation, and how traditionally that's been viewed as a real challenge to physical and emotional health for seniors, but now everyone is in the same boat. So we really need to use all of the different tools that we have to connect with one another, whether it's making a phone call or writing a letter or using FaceTime or Zoom, whatever it is. Although you are staying physically apart, 6 feet or more from others, please do make a decided effort to connect with others, because we need each other to get through this. I do so appreciate that we're asking you to do very difficult things. We're asking you to stay off trails. We're asking you to cover up your face. None of this is easy. Having all of our usual routines interrupted is really hard and challenging for all of us. But we can rely on one another to get the jobs that we need to done and to get through to the other side. So I appreciate your attention. We are here to help and support you. You can call Town Hall, you can call the Board of Health. The number is 468-5520. And Board of Health is extension 4. And you can, there's an automated line to tell you all the other numbers. I will reiterate that the 211 line for Massachusetts Information and Help is ready and available. Just for mental health, I would say I'm so glad that you've tuned in tonight, but one of the key things that all of the sources say is take a break for your mental health. Turn off the news, turn off the radio, turn off the COVID stuff. Put on a good song and kick up your heels and focus on something else for a while, because it's not going away, but you don't have to be paying attention to it 24/7. None of us do. So thank you so much for your attention, and I wish you very well.
Thank you, Mary Beth. And I want to take the opportunity to thank all of our panelists who have done a tremendous job during this crisis and are really trying to make sure that our residents are up to date with the information, with the latest information as quickly as we find out information that we want to get it back out to you. I'd also like to remind everybody that the forums will be streamed again on HWCam, and questions that were asked in the forum this afternoon as well as tonight will be added to our frequently asked questions section on the website. I want to thank again everybody for tuning in. Please stay safe and we wish you well. And if there's anything we can do for you, you can call my office at Town Hall, 978-468-5520, extension 2. We'll assist you in any way possible. Thank you, everybody. Good night.